coronavirus in Victoria. That's 331 new cases since yesterday's update. I'm saddened to have to report that there are now 246 Victorians who have passed away due to this global pandemic. That is an addition of 19 further deaths. The number increases by 18. It's the same as yesterday. There's reporting done in quick time, and sometimes there's just a need to reconcile. So 246 is the accurate total. It has only gone up by 18, but there are in fact 19 additional Victorians who have passed away. I can't provide too much detail, but what I can, I'll now go through for you. One female in their 50s, one male in their 70s, 6 females in their 80s, 4 males in their 80s, 4 females in their 90s, and 3 males in their 90s. 14 of those 19 deaths are linked to aged care outbreaks. Can I take this opportunity on behalf of all Victorians to send our condolences, our sympathies, our love and support to each of those 19 families. This will be an incredibly difficult time for them, and I hope that that pain is made a little more bearable, knowing that Victorians are with you in grief and loss and sadness. There are 650 Victorians in hospital. 47 of those are in intensive care and 24 of those are on a ventilator. A total of 1,854,688 test results have been received, which is an increase of 34,090 since yesterday, so a significant day in terms of test results and activity. There are 2,903 cases with an unknown source. That's an increase of about 100 since yesterday's report. 1,185 healthcare workers who are active cases. That's up, but up by a smaller number than has been the case in recent days. But it really does, like so much of this data, it takes a longer time period before we can start to see whether there's any pattern, any shift in those infections. Each of those are of great concern to us. Each of those are motivating us to redouble our efforts right across the board to make sure that we're protecting those people, taking care of those people who take care of us. There are 1,838 active cases in aged care settings and 7,880 active cases across the whole state. The regional metro split is pretty well constant. I think we're up now to just under 520 regional cases, so a small increase, but nothing like the increases we have seen in Stage 4 metropolitan Melbourne, albeit those numbers do seem to be stabilising. But I again hasten to add, I'm not here today to provide you with any definitive claims about trends. That'll have to be borne out by the actual data, particularly as each day passes where we have the impact, the effect of Stage 4 restrictions. I just wanted to make a couple of references to a couple of issues that have been topical for all of us for many weeks now. Aged care shifts. We have sent into aged care facilities, private aged care facilities, nurses that have covered 1,148 shifts. That is a massive effort in often confronting and challenging circumstances. So I just want to send the best wishes and the thanks of every single Victorian to each and every one of those nurses, and I have to say to their families. This is a very, very challenging environment, and those nurses have done us proud, together with personal care workers and a number of others, many of whom don't necessarily have a clinical qualification or wear a uniform, but the coordination and the planning of our crisis response in a number of these private aged care facilities has been a credit to all of those involved, and I'm very proud of them. So that's 1,148 shifts. That is a massive effort, and everybody involved, I'm very proud of you. I'm very, very grateful, and I know that despite the very challenging circumstances that so many people in private aged care find themselves in, I'm sure the care and the courage and the compassion of those nurses and others, not only is that a comfort to residents, but it's certainly a comfort, I'm sure, to family members as well. I just wanted then to give you a quick update in relation to business support, and then we can move to taking your questions. There are payments of $5,000 have been made to around 24,000 eligible businesses. That's totalling $120 million. That was that $5,000 payment that we had announced. We have since increased that by another $5,000. Those businesses who have received that payment or have applied for that $5,000 payment will not need to submit further paperwork. They will be paid an additional $5,000 to take that up to $10,000 as a second wave payment, if you like, and there was also a $10,000 payment from the first wave, so that'll be for those businesses around $20,000 in support. I can also confirm that there's around $776 million or $77,600 $10,000 grants that have been paid out to businesses as part of our $1.7 billion economic survival package, one that we've talked to you about many times. But we are pushing those payments out as quickly as we can, trying to do that as easily as we can, trying to minimise the amount of paperwork and the time that's taken. The Business Victoria website is the place to go if you have received a payment or if you believe yourself eligible. That's where you can find the detailed criteria. Essentially the job keeper criteria will see you through, and particularly reflective of some of those recent changes that we're grateful to the Commonwealth Government for having made those announcements. It essentially mirrors the JobKeeper, the criteria under the JobKeeper scheme. Just finally, we have today released some traffic data, so whether it be trains, trams, buses, regional rail, regional buses, as well as traffic data, road data. We're seeing a massive reduction. I'll give you an example, 43,000 tram trips and 71,000 metropolitan train trips, which is about 10%. That was on Friday last week, so that's about 10% of what we would normally have on a Friday in August. In other words, we've got a 90% reduction in movement. And I know that's very challenging, and I know why that's occurred, because we have sent home many hundreds of thousands of workers, but that data bears out that the strategy is working. That's one of the inputs in terms of the outcome that we're all working towards. We've got to keep seeing these numbers come down. We've got to keep seeing transmission at a much lower level. The public health advice to me, all of our experts remain convinced and very confident that as we're just into the early parts of the second week, not even yet a full week of many of the stage 4, the most significant changes, we will continue to see data that forms a trend, and we'll continue to see numbers coming down. Exactly how long this takes and to what the lowest number we can get to, that's only time will tell. But there is no alternative, there is no choice. We've got too much movement in the community, too many cases, and until we address that movement, which this data shows we absolutely are, then we won't drive down those case numbers. Just finally, before we go to questions, we obviously remain deeply grateful to every single Victorian who's doing the right thing. We are a strong community, we are a proud community, we get through difficulty each and every year, whether that be in our own personal lives, in local communities, or as a whole state. We are, all of us, equal to this task. It is very challenging. We've never seen anything like this before. But if we all stick together and if we all work together and we understand that the contribution must be a shared and joint one, must be a shared and joint contribution to a collective benefit that we will all share in. That's getting through this quicker than we otherwise would, getting past these restrictions quicker than we otherwise would, and then beginning the really challenging job of rebuilding with strength and with an absolute determination to make sure that Victoria comes out of this stronger in the medium and the long term. That's what we're going to achieve. We are equal to this, but it only works if everyone plays their part. It only works if we all acknowledge that we are in this together and that we look out for each other. That's, I think, something we are well known for, something that I know has been tested. There is great frustration, there is anxiety and concern, there is a sense of fatigue. No one wants to be in these settings. But the public health experts have told us, they've made it very clear, this is the only way we'll get these numbers down. It's a 6-week strategy. That's much better than a 6-month strategy, which would have been the case if we'd stayed at stage 3. So I am very grateful. Once again, if you've got symptoms, even mild symptoms, come forward, get tested. Stay at home till you get your results. If you're positive, stay at home, isolate away from other people. If you don't have symptoms, if you're an ordinary Victorian, no matter where you live in the state, there are rules that will apply to you. please make the best choices, not just for your family, but for every family. And if that's not enough, please make the choices to avoid a fine, because Victoria Police are out there and they will fine you. And if that's not enough, please make the best choices so that our health heroes are not getting sick, that less of those nurses and doctors, ambulance paramedics and the whole health team make better choices, the best of choices, so that less of those heroes finish up sick. That, I think, is a powerful motivator amongst many others. Happy to take any questions you have.
What would you say to those health workers to motivate them to keep turning up with the numbers so high in terms of healthcare workers?
One of the great privileges of my working life, and indeed as a father as well, and as a son, I have seen health heroes in many settings. I don't think that they need any motivation from me. They are a unique breed. They are amazing people. And I think about all the nurses and midwives, the doctors, both surgeons, physicians, allied health practitioners, ambulance paramedics, cooks, cleaners, ward clerks, car park attendants. I've had the great honour, one of the greatest honours of my life is to have met so many people from this sector. There's not a hospital in this state that I haven't been to. One thing's, they're all different because they all serve different communities, but one thing that is an absolute constant, the people who staff and make our public hospital system work, the people who work in our ambulance service, the list goes on, are a special breed. We will support them with the PPE they need, with the support that they need, to whether it be to be away from their family if someone's vulnerable, or to stay well away from their family so that their family was not infecting them. This is a great challenge, one that we've never seen the likes of before, but they're such an impressive group of people. They really, really are, and it makes you proud to know that they're there every minute of every shift in every setting. Not even, in some cases, not even settings that they have anything to do with. Our nurses working 1,148 shifts in a part of the care system that we have nothing to do with. Private aged care is not down to them or us. It's run by the Commonwealth. But you've got nurses and personal care workers going in there. They're not paid by the private sector, but they're going in there working as hard as they can. They're a special breed, and I just say thank you to them. But if you really want to thank them yourself, then don't do anything that would spread the virus, because if you do, more health workers will have to treat more critically ill patients. If you're making choices to spread the virus, then more health workers will have to treat more patients and more health workers will get sick. So if you honour them, if you want to thank them, as I do, then make the best choices for your family, for every family, and for our dedicated health heroes. We monitor this in real time though. It's not static, and any further steps we can take to support our health workers, of course we would.
Just on PPE, Premier,
Sure.
I know that there were some high-level meetings between the Department of Health and College of Nurses and College of Physicians about
Yes.
supply, because even though you've got a warehouse full, it's clear that not everyone's getting what they need. What was the outcome of those meetings? What's going wrong and what can be done to fix it?
Sure, I haven't got a briefing yet from those discussions, other than I am assured that they have occurred, and that's really important to listen and to try and get that feedback from on the ground. At the same time as those concerns are important to follow up on, I'm also getting reports from across the board that health staff, regardless of what role they play, are confident that they've got the PPE that they need. I think there's some variance here, there's a bit of variability.
That's part of the problem, isn't it?
Well, indeed, and that's why it's a big system, and it's a devolved system, but trying to make sure that there's as much consistency as possible, that's what's driving us. And I'd be confident, again, if there's further information I can come back to you on as a result of those direct meetings, I'm more than happy to do that. But my last report, which was sort of late last night, was that there's been a power of work go on to make sure, just to double check and triple check that all the supply lines are open, that orders are being processed as quickly as possible. I can be absolutely confident when I say to you that all those numbers I read out the other day in relation to goggles, gowns, masks, face shields, gloves, all of that, those numbers, we're adding to those every single week. And there are deliveries, as I said, I think Monash Health received a very significant delivery yesterday, which they will then distribute amongst their many different sites. So it could be that there is a bit of, things are a bit variable in some places. It could also be that there's perhaps a sense in some health settings that things that are available in fact aren't. We've got to deal with that as well, because it is about perceptions and about a sense of safety as much as it is about actually having boxes of this stuff in storage rooms at the local hospital. It's everything along that way, and I'd be confident that people are working on that. If there's anything more from a specific point of view that I can come back to you on, I will.
On contact tracing, obviously you can't know about individual cases, but we have heard about a woman whose family was tested positive 12 days ago. Still haven't heard from contact tracers. Surely that's not acceptable.
Well, I'm happy to follow up if you give me that person's details, if there's any further information I can provide you on a specific case. All I can do is talk to you about what we have put into this system. We're now at 24, 25, perhaps even as high as 2,600 people. Whilst they work in shifts, there's coverage the whole day through and well into the night. When I make, as I sometimes want to do, very, very late night phone calls, there is a whole team of people working, and that's why they can give me details and answers when I ask for them, either at an unholy early hour in the morning or very late at night. They are there, I can tell you, because I've spoken to them. They are there 24/7, and they need to be, because the virus doesn't stop. I can also take you to, I'm happy to get these numbers confirmed for you, because there'll be a further update today, or at least a further update since the dashboard first stood up last Friday. We are contacting all of our cases within 24 hours. We are contacting close to all of our close contacts within 48 hours. We've also cut down the time between you getting notified of your test result and us getting notified of that test result. I think that's running at an average. There's a little bit of variability between different labs. I think I said I'd come back to you on this yesterday. It's about 2 hours. So between when you get the text message saying you've got it or you haven't, we then get notified on average around 2 hours later, and then the work begins. That's when the 24-hour clock starts. That's when the 48-hour clock starts. Now, I've tried to think and to explain to you where some of these discrepancies may have come from. That one we need to follow up. But there have been some others where I think people have perhaps expected a call. They thought they would get a call. That's not your example, but some others. When in fact they were not a close contact and they were never on a list to be called. That's still distressing, in the sense that you should have received something that you didn't, even if you didn't need it or you were never part of that system. That can still be something that's of concern. But that national dashboard and the accountability that comes with that is really important. So it's a big team. The door knocking, I think, helps here a lot too. So there are a group of people where we can't get them to answer their phone for one reason or another. It can even be the wrong digit is put on the phone number, or it's a handwriting issue. There's all sorts of reasons for it. Any group, particularly large groups, if you try and get everybody on the phone, you'll always struggle with some. So we're working through that, and the ultimate safety net here is ADF personnel and authorised officers from the health department. They're now up over 12,000 door knocks, 10 to 12,000 door knocks. I haven't got the number in front of me, but I think that's around about the number. They are literally going door to door, every case, and then every close contact for the purposes of compliance, but also for the purposes of providing practical support and answering any questions that people have. But Brett, if you've got a specific case, if you come back to me, then I'm more than happy. Come back to Steph offline. I'm more than happy to try and chase that up.
Premier, the case Brett's talking about, she was notified on the 30th of July she was positive. She still hasn't heard from DHHS. She doesn't even know whether she needs to get retested or if she can even come out of quarantine.
I can understand that would be deeply frustrating for that person. That's why I'm happy to follow it up. I'd like to know what's going on there as well. But look, when you're talking about, you are talking about 15,251 total cases. Now, they don't all come at once, but that sometimes feels like that, I think. But it is a very, very big task. And then you say each of those cases is probably accounting for, say, another 4 or 5 close contacts plus outbreaks, where some of those, that close contact net, if you like, is hundreds of people. So it's a very, very significant task, and that's why.
It's a massive task, but I also feel like we've been asking these exact same questions for weeks with people who are coming to us with these stories, and we keep getting told by yourself and Brett Sutton that everything's okay, we're all meeting our targets.
No, I'm not saying that.
It's a massive system and everyone's working hard.
It's not me saying that we're meeting our targets. The data shows we are. That's just a fact. That's the first point. Second point, though, I'm never going to be able to stand here and say to you that on any given day, someone who should have got a phone call, that every single person that should have got a phone call got that phone call. When you're dealing with this many people, when you're dealing with this task, as challenging as it is, You can never deliver something that is completely perfect. There will always be some error. This is humans talking to other humans. It's a massive task. The key point, though, is to learn from each of those, drive constant improvement. I don't think there's a treatment here or a change that would find us half a day, for instance. But I think there are lots of things where you can always look for refinements and improvements, and that's been the journey, where you find minutes and maybe an hour, and that's why we're seeing our response, despite the fact that cases have grown, I think our responsiveness has improved, but it will never be perfect. And that's why, I've got no problem with people raising specific individual cases. If we can follow that up, we're more than happy to do that. If there is let's get that person the information they need, that's the first thing. And secondly, if there's anything to learn from that case, I want to know what's gone wrong there so that we can take some steps to try and fix that.
Premier, of those 1,800-ish health workers,
yes,
is the government keeping a tally of how many are picked up in the workplace and how many are picked up outside, and what does that look like? Sure,
I don't have... let me give you a commitment, as I do most days, and then I'll try the following day or the day after to come back and honour the commitment that I've made to you. I'm happy to try and get a breakdown of that. It'll be a mix, basically. So there will be a number of people who, because of the high risk setting they work in, and they will have contracted the virus at work. Others will have, with the amount of community transmission we've got, the amount of mystery cases we've got, others will have contracted it in the community, and we won't necessarily be able to pinpoint exactly who that index case was. So who'd you get it from and in what circumstances? Then there'll be other chains of transmission that are well away from the workplace. So I do know that there have been significant numbers of workers in every setting, even in healthcare, that didn't get it anywhere near healthcare. They've got it from a family member, they've got it from somebody from another family who spent time with them, and then of course there are some mystery cases as well. But it is fair to conclude that if you're working in a really high risk environment and you're spending long periods of time, even with the very best PPE, you're at much greater risk of getting the virus if you work in those environments. And that's why the work that those staff do is so impressive, and it's why all of us, one reason among many, why all of us should be making the best choices possible to get beyond this and not to expose those health heroes to any more risk than they absolutely need to be exposed to. The ultimate way to thank them is less cases. That's because that'll mean less people in hospital, that'll mean less families having to plan funerals, and it'll also mean less health workers having to deal with this virus that, as I've said a number of times, you can be otherwise healthy and it can have terrible consequences. You can be in any age group and it can have terrible consequences. And then there is that, I know we harp on about this a bit, but it's very important to make this point. Just as we saw yesterday with the ads that we launched, there are a growing number of people that are getting this, and they're not getting over it like a cold. It is presenting in a stubborn way, with more like a chronic illness than a common cold that you would have, endure, and then get past. So for all those reasons and more, the best choices is how we'll protect our health workforce. If I can get you a further breakdown of where we think the point of origin is, that'll never be definitive, but if we can get that, just even to give you a sense, I'm more than happy to ask the public health team for that.
And also a breakdown of what occupation they have, whether they're a nurse or doctor. Is that possible to get?
I don't know that that's possible, but I'll certainly ask the question. I'm happy to try and give you as complete a picture as we can. So just to be clear, you'd like, of those active cases, they'll be probably easier to deal with. If I can do a look back as well and give you a more global picture, I'm happy to do that. So what's the point of origin? So is it workplace or some other setting? And then a breakdown by specialty or by role that's played, yeah? If I can do settings as well, because you'll have some people who are a hospital, as I've just said, you've got 1,148 shifts in private aged care. That's got nothing to do with the day job that most of these nurses do. I'll try and get you a breakdown of settings as well, because some of it will be positive case, they're a nurse, but they weren't doing nursing in a hospital, they were doing care and nursing in an aged care facility. So we'll try and get you as much detail as we can on that.
Is it possible to find out how many healthcare workers are in the numbers of people who are in hospital and intensive care?
Laurel, I won't commit to that, because I think I expect the numbers will be quite low, and there is the possibility of identifying people. Now, of course, we had a health professional here yesterday in the ads. She has since been readmitted to hospital, and we send our best wishes to her. that speaks directly to that notion of persistent, stubborn illness, potentially impacts that will last for a long time. If we're not going to be in, if it wouldn't be, if it wouldn't identify people, and if we've got that granular level of data, I'm more than happy to ask.
From your casual workers who've been stood down over the 6 weeks because of the restrictions from things like meatworks and warehouses, are you expecting most of them to be staying home this entire lockdown? Because we're hearing a lot of going out and getting jobs in the gig economy. Does that defeat the purpose?
Well, if there is, well, I suppose it's a bit challenging to do a definitive analysis on that, because there will be, because of the stage 4, there will be obviously contractions and massive reductions in some workforces, but then there'll be other parts of the economy that flex up. So for instance, that the amount of food that's being delivered through those types of workers in those types of businesses, I'm sure that those numbers are up. We try and track this as best we can, but having only just settled these rules, it's a bit difficult to give you definitive answers on trends. I don't think it defeats the purpose, so I think you'll see but a fraction that get re-employed for that period of time. I'm not going to criticise anybody for that. As long as they're only doing permitted work, then we've got a tolerance, if you like. We've factored in that, yes, there'll be reductions, but there'll also be some other sectors who move up. But overall, that traffic data shows you, just anecdotally, driving in this morning, some of the enforcement data we're getting from Victoria Police, there's a massive reduction in the number of people moving around. That's what will drive down cases. That's what will get us to the other side of this.
Premier, you were saying that we're still yet to see the results of the stage 4 lockdown. Speaking to some experts, they were saying that in the kind of latter week or two of stage 3, there was improved compliance, people moving around less. Do you think it's possible that we jumped the gun a little bit in shutting down workplaces in stage 4?
No, I don't think so. As difficult as these decisions are, as heartbreaking as the consequences of these decisions are, this is the only way forward. Now, just so everyone can be clear, this is not just a matter of me sitting down with Brett or whoever it might be, and kind of making a decision away from the evidence, away from the data. It's not a hunch, not a notion of this is what I think will work. There is always a degree of interpretation. There's always a degree of precautionary principle. So perhaps do more than you need to make sure you get the outcome. And the reason for that is there's a 10-day to 2-week lag. So what's happening now in the data is the result of things that happened 2 weeks ago. So rules, better decisions by people, all of those sorts of things. There is that lag. If we had real-time data, if we could, if you could test everybody at once, lots of ifs, but that's not the way it presents. If the symptoms were much more obvious, if it wasn't as infectious, there's lots of ifs and buts here. But the one thing that we have to be certain of, if we had continued under the stage 3 settings, even with masks, it would not be 6 weeks, it would not be 10 weeks. It would be, I believe, a 6-month strategy, and the data backs that. So that means we get to pretty much Christmas, and we're still closed, essentially. That's not a tolerable outcome. That's why we've got to do everything we possibly can. And I can't guarantee that this works in 6 weeks. It'll only have the maximum chance of working in 6 weeks if everybody plays their part. And that's why we're so grateful that the vast majority of people are. And I think to your point about increased compliance, so less movement, more people at home, more people doing the right thing, so less people doing the wrong thing, that's my sense of it. And I think that's been a trend for at least a couple of weeks, I think. So people are making better choices, and unless they do, then we won't see movement reduced and we won't see case numbers reduced. It's always regrettable. The notion of a curfew, like I didn't think I would ever be imposing something like that, ever. Like no chance of ever having to do that. But these are extraordinary times, unprecedented times. But I'll tell you one thing, as inconvenient as it is, it means people are not going around to their mate's place for dinner. They're not going around for that kind of sneaky, it'll be okay, I feel well, he feels well, or go around and do something that's clearly against the rules, but so hard to police. But the binary nature of you're in up between 8 and 5, and if you're out, you better have a good reason, like work or emergency medical care, makes the job for our police easier, increases the chances of people getting caught, And it just then means that people behave differently. Not ideal, but it'll get us the outcome we want, and that's what we have to be exclusively focused on.
There's a ICU doctor in the Royal Melbourne Hospital who came out to find that she'd got a parking fine from the City of Melbourne. Why are parking ticket inspectors allowed to work during stage 4?
Well, firstly, let me follow up on that matter. I'm sure, well, let me follow up on that matter. I don't think that someone who's in there literally saving lives at considerable risk to themselves should be the subject of a parking ticket. I'll follow that up. In relation to parking inspectors though, as I think you know, they work for the City of Melbourne and other local government. I'm not certain that all parking inspectors are working across the state. Let me go and check the status of their work and let me follow up on that individual infringement. No, I don't think that is appropriate at all.
Should parking inspectors be an essential work at the moment? We've got a lot of other industries that have shut down completely. Doesn't really seem to make sense.
And I think you'll find that there is a massive reduction in the number of people that are parking. So because you've got much less movement. I think the traffic data I reported to you before was in the order of, well, it's down 40-50% at least, if not more. Let me follow that up. Again, they don't work for the Victorian government, but their status can be determined by us, and I'm more than happy to chase that up.
And I guess on that, is someone moving their car a legitimate, so that they don't get a parking fine, a legitimate reason for leaving their house? That's
part of the reasons why I'm going to follow it up for you. So I think there's some knock-ons there that don't make a lot of sense to me. I've always said there's no manual on how to shut down a very large part of the Victorian economy. The notion of trying to make a value judgment about what's permitted, what isn't, what's essential, what isn't, given that the meaning of that term has been fundamentally changed throughout the course of this year. I think there are a lot of workers in our economy that we know they're essential now. We perhaps didn't regard them that way, but we know how essential they are now. We know a lot about insecure work. We know lots of things. There's a lot of learnings that we'll have to come back to a lot of these things once this is over, but you can't build a perfect system when it comes to these rules, but I'm always happy, and we have, I think, demonstrated a genuine willingness to make changes where that makes sense. At the same time though, I understand it when businesses, they talk to you guys, or they write me letters, or they pick up the phone and speak to me direct, and they make impassioned pleas, emotional pleas, because they have a genuine investment, not just in their profits but in their people. So do I. And it's heartbreaking to have to say, no, I can't let you open. Because if you do, we'll have more people at work this month than we had last month. And then the case numbers will just keep going up and up. No one wants that. That's a sure way to have Christmas under these sorts of rules. And I don't think we want to get to that.
Another concern that we're hearing from health workers is about the possible quality of the masks that they're using. And they're saying that mandatory fit testing of N95 masks would be useful. Would your government commit to that?
I'm happy to get some advice on that. Part of listening to your workforce, being open to concerns, is that if there is a concern, then you take steps to try and deal with it. I would just say there's a lot of voices in this, and that's a function of the fact that there are a lot of people doing this work. Now, I saw some GPs yesterday. They've made some comments. They're entitled to their views, and I don't take these things personally. I'll follow it up, but I don't provide them with personal protective equipment. That's in the main done by the federal government. But I'll chase it up, and I'm more than happy to try and fix any problems that are there. In terms of testing the efficacy or the appropriateness of any particular item, that's probably beyond my training level, but I'm more than happy to try and get you an answer on that. I think we do testing along the way to make sure what we're getting, because often it's not made here, it's made in other parts of the world. We have to check and, if you like, validate that the product can do the job that we need it to do. I'll try and get you some further information about that.
Just on PAYAC this morning, you were asked about a request that was made from Victoria to the Commonwealth for some Defence Force personnel, and you said that the person who made that request was not anybody in a position of authority.
In the Victorian government?
Yeah, so the request was made by Emergency Management Commissioner Andrew Crisp. Is he not a person in authority?
No, I think the point I was making, I was talking to a politician about others, and I'm not talking about statutory officers, I'm not talking about public servants, I was talking about, and I think the question was in the context of someone who, like me, who does what I do for a living. So that's the, perhaps I didn't phrase it perfectly, but that is the position.
Did Commissioner Crisp make a mistake in making that request?
No, I've got nothing but the utmost regard for Emergency Management Commissioner Crisp. Does a fantastic job. That's what my experience with him has always been. Can't find a better professional, can't find someone who works harder. He's an outstanding member of the broader team. He's not a member of Parliament, he's not a member of the government. In fact, you wouldn't want someone in that role to be either of those things. He's an independent statutory officer. But as for what he's done, or requests he's made, conversations he's had, I can't speak to that. He needs to speak to that, and I'm confident that he will.
There's some footage of a police officer dealing with a woman who wasn't wearing a mask, and he can be seen to sort of grab her around the throat. Any comment about that?
I haven't seen that footage. I would say though, we have seen, I'm not sure whether it was last week or the week before, and I'll be careful because the woman involved may well be the subject of criminal proceedings, but what occurred to that young constable down in Frankston, I am supportive of Victoria Police being very cautious when they deal with some people who are not wearing masks or who are openly breaking the rules. I'm not commenting on this specific case because I haven't seen the video. But when you simply ask someone to put a mask on and the next thing they're smashing your head into the concrete, then I think you're entitled to have a degree of caution and to maybe assume that things can escalate quickly. I think our Victoria Police have done an outstanding job right throughout this, and I've said this a number of times. There's few years that have been tougher on Victoria Police members and their families than 2020, and they've responded amazingly, and I'm deeply grateful to every single one of them, whether it be task force policing, specialist policing, or general duties officers, our PSOs, sheriffs, Corrections Victoria staff, that whole family. We've got firefighters doing contact tracing, for heaven's sake. Everyone is doing their very best, and they're such an impressive group of people. I haven't seen the video and I wouldn't comment on that specific case, but what we saw last week, it was last week, maybe late the previous week, just awful.
What about the video, the leaked video with the public servants talking about the quarantine program?
You'll excuse me if I also indicate to you that I've not seen that either. It was a very late night, as they all are. It was an early morning dealing with a number of more substantive issues, can I say? And I've not read that. I've not read the article in the paper. I know of it, but I haven't seen the video. I've been far more focused on far more important things. Ultimately, there are people that are working across the board, playing many different roles. They all have different skill sets, different backgrounds, different expertise. But one thing that is common to all of them is that they're all working as hard as they possibly can. And they all want to get to the other side of this. They want to help Victoria get to the other side of this. And I'm very grateful to all of them. Just as I'm grateful to people who are not formally employed to do this work, but through their own choices, through their own behaviour, are making just as powerful a contribution to the fight against this wicked enemy as someone who's working around the clock doing contact tracing. Because it only takes one. One person does the wrong thing and it can lead to a chain of transmission that includes many hundreds. That's what we know. That's the great challenge of this thing. One spot fire that creates an inferno. That's the challenge here. And that's why everyone in the team, whether you're paid, a volunteer or just a punter who is making the right choices, whether you're Prime Minister, Premier or a punter who's making the right decisions by staying at home and following the rules, they're all powerful, really powerful decisions.
Is it appropriate for public servants to spend hours, though, making a self-congratulatory video about the job that they've done?
Well, I'll leave other people to make their own judgments about that. Having not had the time to watch the video, I'm not really in a position to make a judgment about that. I think that staff, whether it be from that department, indeed every government department, are working as hard as they possibly can, together with our hospital staff, together with ordinary hard-working Victorians. They're working hard too. None of this is easy. Following the rules, staying at home, doing the stuff you have to do to drive down movement and then drive down case numbers. None of it's easy. None of it. And that's why we're very grateful to everybody who's playing their part.
Can you confirm, though, without having seen the video, that it was Global Victoria that was tasked with running hotel quarantine?
No, I can't confirm that at all. What I can say to you is that there were arrangements in place, no different to what I said to the Parliamentary Committee this morning. There are arrangements in place that related to whether it be vulnerable Victorians, so for instance someone who was fleeing family violence with her kids, someone who was a nurse and had the virus and couldn't isolate at home because they had a vulnerable person in their household, or a doctor who couldn't isolate at home, couldn't spend time at home because there was a positive case in the household and they would get infected. We'd set that program up already. That essentially switched across and then grew as part of the National Cabinet Hotel Quarantine decision. As for the adequacy or otherwise of those arrangements, there is another process to deal with those. But what I can say, if you were to simply look at the position descriptions or the day job, what's on your business card, and compare it to the work that's going on at the moment, well, we've got ambos and soldiers riding together in ambulances. We've never had that before. This is truly unique. We've got people who work for travel agents, Hello World for instance, who've been stood down, and people who work for airlines who've been stood down, coming and helping us do contact tracing and everything in between. So I wouldn't make a value judgment about what someone did, what division they were in, what part of a department they worked in pre-pandemic, and what they've been asked to do since. People are applying their skills to in lots of areas that they would never have done before. That's the nature of a completely unique environment, and there can be no doubt this is a completely unique environment.
Just on that, Premier, our contact tracing team, our 2,500, it's getting
Yes.
bigger. How many of those are actually contact tracing public health experts, and how many are kind of support staff that are doing administrative
Well,
jobs?
there'll be a mix. Let me come back to you on the public health physician, but then there are other people who are. Well, we've got to be careful here, not to get into any debates with learned colleges, but I think there are a number of people that are well on the way to becoming a public health physician, or at least having sufficient knowledge to be able to do that work. So we've got ambos in there and nurses, for instance, the Medibank private team, for instance. They're not public health experts, but they come to it with a degree of clinical knowledge, and just the volume of work they're doing, they will be absolute experts in this field. Whether they can put that on their business card or not is another matter. I'll try and get you a breakdown of that team. But I think it'd be just looking at those who are a doctor, who are a public health physician. I think that would not tell the story of the expertise and the effort that defines our contact tracing measure, that defines our contact tracing efforts. The other thing too, I'd say, we've got a whole bunch of people in Sydney, Perth, right around the whole country, who are doing a lot of that work for us. So I'll try and make sure they're included in the team as well.
Given the low public transport patronage, do you think those operators are going to need further support through that lockdown?
Well, as I think you're driving at, we have provided some support to those private operators. I'm not aware of any further bids or asks from them, but I don't think it wouldn't be the biggest leap of logic to say yes. There probably will be a need for us to look at that. There'll be many consequences, and we've got to work through each of them in as methodical way as we possibly can. But I'm not aware of a specific proposal now. That's not surprising, given that it's only been a week or so. But if I've got more to say about that at the appropriate time, I will.
Premier, do you have an update on what's happening in aged care? I know that the worst of the crisis seems to have passed, but I imagine with that many active cases, we're going to be seeing some pretty awful news over coming days still. And
yeah, I think that's certain, Laurel. What we know is that whenever we get significant active cases in aged care, given the underlying health conditions and the sheer vulnerability of many, not all, but many of those residents, that we'll see more people die as a result of this global pandemic. We have at the moment 1,838 active cases in aged care settings. That is a very significant part of our challenge. My last briefing, I think Sunday evening, maybe first thing Monday morning, from our team that are running our aged care response. They were reporting to me, just as they had over the weekend and late last week, that there'd been some stability come to some of those most affected, most impacted aged care settings, those that were in real crisis going back a couple of weeks ago. We're seeing some blended teams be stood up, traditional workforce going back in, but we are still seeing some fresh outbreaks in aged care facilities that had not previously. Very low numbers though, and I think that our response and our joint effort out, the help we're giving to the Commonwealth, I think is paying real dividends.
Are you confident then that we won't see a repeat of the Epping Gardens and the St Basil's now
I
with
would
those
certainly.
new outbreaks?
Well, what I can say to you is I'm confident that the team has never been bigger and they've never worked harder, and it's now not just the Commonwealth having to look after these things. We're providing assistance and very important support, and I should give a shout out to private hospitals too. So those nurses, those shifts I mentioned, they're nurses, they're not just public nurses. But we've got close to 400 patients that have been transported. That's very challenging. It probably seems quite a simple thing, you know, put the person in the ambulance, go to the hospital. We've got a lot of people with underlying issues, very great frailty, many people who have got geriatric conditions, whether it's dementia, Alzheimer's, those sorts. It's very, very challenging. That sheer number of transports that's a huge effort. I can't rule out that we'll finish up with more cases in aged care, but I can certainly confirm for you that the team, it's a big team, and we're all working very, very closely together to make sure that we avoid some of those scenes and avoid that crisis that did grip a number of those facilities.
Brendan, given we've seen, I think it's in the last week alone, 100 Victorians die from this disease.
Yes.
Based on your modelling, would you expect to see a similar figure over the next few days?
Oh, look, it's not for me to talk about those matters. I'm briefed periodically on not so much forecasts, modelling, but on what would be a likely rate per 100 or per 100,000, as the case may be. There's always some variability there, but I fear that we'll see more people die because we have more people in hospital, we have more people in intensive care, and we have many active cases amongst the vulnerable. But I just again stress, I wouldn't want that to in any way give anyone this false sense of confidence that if you're otherwise fit you can't get this, and if you do get it, it won't matter. Or if you're young, we've still got about 40% of our cases between 18 and 44. It might be 15 is the bottom of that range, I'm not quite sure, but it's in that sort of late teenage through to middle 40s. That still accounts for 40+% of our cases. And we have seen around the world, and even just in the last week or so, I've had to stand here and report a number of 50-year-olds who've passed away, 2 people in their 30s that have passed on. The notion that this won't get you, or that it's a cold and you'll get over it. You've got chronic illness for many, long tail to this, and you've got tragedy for some also. And you also got to acknowledge that this data set is much smaller. So we haven't had 70,000 cases a day like they're getting in the US. So they, of course, with a much bigger spread, that tells you the story of what happens if it truly gets away from you. They're seeing people dying in all age groups. So we will see more tragedy. That's the nature of this wicked enemy. That's why we've got to drive down movement, to drive down case numbers, to mean there's less people in hospital, and to get us to the other side of this.
You spoke before about the healthcare worker who was here yesterday. Said she'd been.
Yes. So there was a man and woman. They're both midwives. They work at the Royal Women's Hospital. The female midwife, she had been in and out of hospital and was readmitted yesterday, the day before actually, I think, when the ad was finalised. So we just send our best wishes to her and her family. We send our best wishes to every family that's dealing with this. It's not just about older people, and it's not just about sick people. This can cause tragedy in any family at any time, and that's why we all have to make the best decisions. And that's why I'm confident, just like all the other challenges we face every year, every day, whether it be personally, as a community, as a state, summer, winter, whenever it is, we face lots of adversity and we always come through because we are a strong people. We are united, and for so long as we keep working together and looking out for each other, we will get the movement down, the numbers down, the number of people in hospital down, we will get to the other side of this.
This might be more of a question for the health experts, but they're obviously opaque, so I'll put it to
I'm
you.
happy to pass them on for you, Rachel.
There's been a lot of enthusiasm in sections of the medical community and the media about the use of ivermectin, the head lice drug,
Yes.
on COVID, and I understand
have read a
that some
couple
of
of
the
articles
research has
about that.
been done in Victoria. Is that something that the government's looking at?
I wouldn't say the government as such. I think there's a range of research programs that are on. Our job is to provide the money that tries to underpin some of that, and I don't think that we've ever provided more support than we have in recent times, outside the mainstays of cardiac cancer, things of that nature. I'm happy to follow that up. I've read a couple of articles too about that. Look, I think there's a movement across the world. There's clinician scientists who are out there doing amazing work. They're looking at all sorts of novel therapies for a novel virus, and we wish them all the best. Whether we could get a more effective treatment, the ultimate vaccine, everything in between. Method can also be part of this, tactics and strategy. There's different elements to this. But I will commit to you that I will have somebody from the public health team and/or someone from another part of the department come back to you directly on that issue.
Regional Victoria, a lot of companies have switched over to making medical equipment, ventilators, etc.
Yes.
Would you like to see, whether it's a policy or an encouragement for that sort of equipment to be used in public hospitals in Victoria ahead of, say, those from overseas?
So for us to prioritise buying any stockpile that we might be left with at the end? Yeah, absolutely. I think that we'll make it. Well, we've actually ordered a lot of this equipment, so it belongs to us now. So it belongs to every single Victorian. That'll mean we don't have to place other orders that might otherwise have gone to other parts of the world. The other thing too, I don't make this as this shouldn't be read as a criticism of the national stockpile because I'm not making one. But I think one thing that this has exposed, one thing beyond insecure work and all those other points I made before, we should acknowledge that perhaps we're in a century where we see more of these events. You can't be certain. I think the more stockpile that we have, all of us, both the states, territories, national government, so that you're not having to fight the world for everything that you need at the same time as they're trying to desperately secure it as well. I think a Victorian medical stockpile, we have one already, but one that's dedicated in this context, I think that might be a really wise investment for us to make. We've always made our contribution to the national one. We've always got stores and supplies at a hospital level, but the notion of us replicating some of that, I think that might serve us well. The shelf life on some of this material is very long, and you can replenish it, on a periodic basis. But look, any dollar we can spend locally, Brett, believe me, that's what we're going to be doing. Not everything can be sourced here, though. I do want to stress that. On masks, for instance, we've just about run out of capacity for businesses here, so we have had to source some others from other states, and I think there's probably some from overseas coming too. But the reusables, first call went to locals, and they've done a mighty job. Hundreds and hundreds of thousands that are being manufactured, and the lion's share of more than 2 million. That's what the total order is.
There's been an outbreak linked to a rehabilitation centre in Ivanhoe. There's some questions about the handling of it that caused a bit of trauma for people that were in there. I don't know if you've heard about that.
I haven't, but what I can say though is, even though the Chief Health Officer's not here today, the show release will come out a bit later on in the day, so that'll go to outbreaks, and if there's any further information we can provide to you, we will.
So it's another kind of vulnerable setting, and It seems like they weren't...
Disability, I'm not sure whether this is a disability provider or whether it's like a subacute health provider.
I think it is more, yeah.
Oh, okay, right. So that's an extension of our health system then.
I suppose the question is, how can you give Victorians confidence that those vulnerable settings are being proactively protected? Because it seems like another one where it
Well, there are comprehensive plans, site by site, service by service, across the health system, across aged care now. Again, I'm going to be very careful not to cut across. I know there's hearings going on today, the Aged Care Royal Commission. I don't want to cut across that, but there are plans in place, a lot of hard work going on to try and assess and then manage and have a nimble and flexible response to each of those settings. Wherever there's vulnerability, then obviously we have to be there first before the virus gets there. That's what's always driven us. It's pretty challenging though, but on that particular facility, I'm more than happy to try and get an update for you. I'm trying to think which service you might be referring to, but if you let me know offline, I'll get you an answer.
Premier, JBS is reportedly considering closing its abattoir for the rest of the Stage 4 restrictions. Have you heard about that, and are you worried about a shortage of meat in Victoria if other abattoirs follow them?
That issue's not been brought to my attention. I'm not saying it's wrong, but I've not had that issue raised with me. We're in almost constant contact with beef, lamb, pork, chicken, and the seafood industry to make sure that we are getting them to wear the right PPE, getting them to mitigate the clear risks their industries pose to the spread of this virus, whilst at the same time finding that balance point so that the shelves aren't empty and the people can get what they need. Not necessarily everything they want, but everything that they need. On that particular abattoir, that's not a matter that's been raised with me, but I'm more than happy to follow that up for you.
Do you have concerns about essential workers who live in regional Victoria travelling in and out of Melbourne, that movement?
Look, I'd like to see as little movement as possible between regional Victoria and metropolitan Melbourne in both ways. You know, I'd also like to see people that live in Albury but work at hospitals in Victoria able to go to work much more easily than they can now. Borders are closed, there are checkpoints, there are all sorts of limitations. It's not easy in any way. I think that people, particularly those who are coming to Melbourne from regional Victoria, they know and understand how important it is to keep this out of regional Victoria and keep the numbers really low. And I think that it's got to be really clear, and we've tried to be. People that live in Melbourne who are going to regional Victoria, you can only go if you absolutely have to. If you can defer a trip into regional Victoria, do not make the trip into regional Victoria. That's the safest thing to do. The last thing you'd want to be is a Melburnian responsible for taking this virus into regional Victoria. Now, sometimes people will do their very best and they won't know. But anybody who's got symptoms, you shouldn't be travelling anywhere other than to get tested. So people have got to be acutely conscious of that. And I haven't been up home for like this year, I think Christmas, and I don't think I would, because again, I wouldn't want to be contributing to a community up there 2.5, 3 hours away. They've got very few cases. I wouldn't want them to have any more than that. In fact, I want them to have none. So that's what the whole strategy's about. Any other issues? Bit of follow up there. We'll chase all that for you, and I will see you tomorrow.